The detection of JN.1 SARS-CoV-2 variant in Kerala has sent off alarm bells ringing. This is especially because many countries globally are seeing a rise in COVID cases. But do we really need to worry, and what is the variant all about? Hello and welcome to The Print. I am Sumi Sukanya Datta, and in this special broadcast I will talk about the new COVID virus variant. The Union Health Ministry on December 16 issued a statement saying that a case of JN.1 subvariant of SARS-CoV-2 as part of the ongoing routine genomic surveillance activity has been detected. This came amid rising cases of respiratory illnesses from some states in India, mainly Kerala, which has also put neighbouring states such as Tamil Nadu and Karnataka on high alert. The government statement said that the patient identified as infected with the variant had mild symptoms of influenza-like illness and that he has since recovered from COVID-19. According to reports, like many countries in Europe and Asia, respiratory illnesses are sweeping a large number of areas in the United States as well. The US Center for Disease Control in its last COVID-19 update on December 8 identified JN.1 as the fastest growing SARS-CoV-2 variant. The continued growth of JN.1 suggests that it is either more transmissible or better at evading our immune systems, the US CDC has said. It, however, added that at this time there is no evidence that JN.1 presents an increased risk of public health relative to other currently circulating variants. Also, there is no indication of increased severity from the variant yet. But some countries such as Singapore have rushed to press precautionary measures such as mandatory masking in public and travel advisories. India too overall has seen an uptick in cases. As on December 18, the country had 1,828 active infections, 127 higher from a day before. Till about 2 weeks back, the active infections were lower than 100. At 1,634, Kerala has the highest number of people with active infections. Is JN.1 causing the surge? Senior virologist Dr. Shahid Jamil, who is associated with University of Oxford, told us that JN.1 is a sublineage of the BA.2.86 Omicron variant that was first seen in Denmark in July this year. He said it has one more mutation in its spike protein that allows JN.1 to infect cells better than its parent virus, and consequently it has spread faster in recent weeks. The variant was first detected in the US in September, and by the end of October, it made up less than 0.1% of SARS-CoV-2 viruses. But by early December, it comprised between 15 to 29% of SARS-CoV-2 infections, which indicates a rapid spread. According to scientists, that can happen only by greater infectivity or immune escape or both. But as yet, we don't know for sure which is the bigger contributor. They also say that the emergence of JN.1 underlines only the normal evolution of the virus, and small changes will mean small spikes, especially in the holiday season. But it's not like the appearance of the widely divergent Omicron that was very different from previous variants as per the experts. They told us that even though Omicron caused a lot of infections around the world, fatality was much lower due to immunity from vaccines and previous infections. With JN.1, it's going to be no different, and unless people start showing up in hospitals, there may not be a need to worry. Biologist and medical researcher Dr. Anurag Agarwal, who is with Ashoka University too, said that JN.1 does not appear any more likely to cause severe disease, but can cause new infections. Experts, however, underline the need for population-level surveillance for virus circulation and infections. There is a need to know antibody levels in Indians after COVID-19 vaccines and presumably several rounds of infections, they say. Jamil said that the last country-level Indian Council of Medical Research or ICMR Sero Survey, which is a test to know antibody levels against a pathogen, was carried out in July 2021, and it may be time to do another. Thank you so much for watching.